Madam Chairman, thank you for convening the hearing. I appreciate that. I also want to thank Senator Burr for asking me to substitute in as ranking member today on this incredibly important and certainly timely conversation as we talk about mental health and substance abuse disorders. Madam Chairman, you have outlined well, I think, the statistics, the challenges that we're seeing. We have known for years now that mental health and substance abuse disorders have really been at crisis levels in many parts of the country, certainly in my state of Alaska, and we have seen those challenges and those issues only further compounded by this pandemic. Access across the country, access to mental health and substance use care remains severely limited, exacerbating suicide and substance abuse rates. You've mentioned the statistics in your state, Madam Chairman, with regards to mental health providers and facilities. In Alaska, more than 80% of our communities do not have sufficient mental health providers. Well, again, we're seeing this crisis only continue to elevate, and unfortunately, it knows no barrier on the spectrum. We are seeing more and more young kids. I mean, it used to be when we were talking about suicide statistics, we would look at that 25, 45-year age bracket. And now the alarm that we're seeing is in 10, 11, 12-year-olds who are suffering. And we have an obligation to hear and to respond. Alaska ranks second in the country for suicide deaths. We've seen a sharp increase in drug overdose deaths, just as we have seen across the country this year. Alaska has one of the highest rates of binge drinking. Suicide rates amongst members of our armed services have doubled. We have seen some very disturbing trends of late. And as we've seen across the nation, our Native people face shockingly disproportionate rates of mental and behavioral health and substance use disorders and suicide. And these are statistics that keep you up at night, not just because that they are numbers, but these are real people. These are our constituents. These are people in our neighborhoods, in our communities. They are people who are in pain. And as we will hear from the young woman Claire Rainier, who will be introduced in just a moment, a youth advocate from Anchorage, Alaska, she urges us, she reminds us that these people that are not statistics, but these real people are looking to us. They're watching the leaders, waiting for us to do something. And I think the message of hope needs to be that we are paying attention, that we are listening, and that we are working together to try to address some of the root causes of what we've seen. I think just within this committee, we've seen some strong collaboration on efforts. I've been working with Senator Hassan on the Mainstreaming Addiction Treatment Act, which allows healthcare providers to prescribe buprenorphine, which can truly save lives with the medication-assisted treatment. In addition to life-saving substance use treatment, we know that we have to invest in wraparound recovery services. I've visited programs in Alaska that focus not just on preventing the overdose deaths, but also really building a community for Alaskans in recovery, because that has to be the follow-on. We've worked on efforts to reduce fetal alcohol syndrome disorders, to address the mental health needs. Senator Smith and I are leading both the Mental Health Professional Workforce Shortage Loan Repayment Act to bolster our supply of providers, but also the Telemental Health Improvement Act to ensure that insurance covers these critical services. Senator King and Senator Kelly and I are working on the Effective Suicide Screening and Assessment in the Emergency Department Act to provide resources for emergency room personnel to identify, assess, and treat individuals at risk of suicide. I think, unfortunately, we know that's where far too many who are seeking help end up. sitting in an emergency room where you don't necessarily have those that are trained to identify and assess. Later this week, I'm going to be introducing the Guarding Our Mental Health Act to prevent Coast Guard members who seek help from for their mental health from being automatically processed for discharge. Again, we know we've got to make headway on the stigma issues associated with mental health. And then with Senator Rosen, we're going to be introducing the Youth Mental Health and Suicide Prevention Act to ensure that SAMHSA can provide additional mental health programming to elementary, middle, and high school students. So, Madam Chairman, I think we know around this Senate here, there's plenty that can divide us. I would like to think that mental health, substance abuse, these are areas where we really can find true bipartisan consensus, and hopefully we can build a package that addresses these issues head on. And I commend the work that you have made along with Ranking Member Burr to do just that. Again, I'm looking forward to being able to introduce the committee to a bright young Alaskan, Claire Rainier, and when it is appropriate, I will do that. But thank you, Madam Chairman, and I look forward to the testimony from all witnesses today.